Hello and welcome to today's show. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today we're going to discuss cervical cancer, and we're joined with local OBGYN, Dr. Amanda Wagner, and we're so excited to hear what she has to say today about cervical cancer. I want to share just a few statistics with everyone about cervical cancer. Cervical cancer is highly preventable as long as you take the right measures, and we're going to discuss that a little bit later. But each year, the American Cancer Society releases statistics on different types of cancer. Cervical cancer happens to be one of those, and for the United States, they estimate that 12,710 cases will occur in 2011. When you look at Kentucky, they say 210 cases. The Kentucky Cancer Registry will break this down further for us, where we can actually see what happens in our purchase area. And from 2004 to 2008, there were 44 cases of cervical cancer in our area. And when we look at McCracken County, there were actually 16 cases of cervical cancer. On the flip side of that, there of course is mortalities that are related to cervical cancer. And when we look at the number of deaths, the American Cancer Society estimates that this year in 2011, 4,290 women in the United States will die from cervical cancer. When we look at that same year from 2004 to 2008, the Kentucky Cancer Registry showed that there were 17 deaths from cervical cancer from 2004 to 2008. And for McCracken County, we had 7 women die from cervical cancer. And so today we're going to talk to Dr. Wagner about how we can prevent those numbers. And some of that can be done just by yearly visit to you, right?
You got it.
So let's just start off talking first a little bit about yourself. How did you end up in Paducah and your practice?
Well, I'm a Nashville native, so
just a little down the road.
Yeah. Paducah was naturally, it was an easy choice for me. Not too far from my family. I actually trained up in New York out of Staten Island through New York Medical College, and finished residency in 2010, and I've been here ever since.
All right.
Yeah.
Well, welcome to Paducah.
Thank you. Thank you.
Today we're going to talk about cervical cancer. So let's first actually talk about what actually is the cervix. A lot of people may not even know where it's at.
Yep. So the cervix, very important. The cervix is actually the lower half in a normal sized uterus, the lower half of the uterus or the womb. Okay. Okay. And the cervix actually protrudes into the upper vagina. Okay.
So now that we actually know where the cervix is and what purpose it is, what's a simple test that can be done? Women should have these done every year, but let's talk a little bit about those.
Yep. So I think you're talking about the Pap Smear.
Yes.
So very important test. This is actually, it's a collection of the cells on the cervix, and we do this every year, not to be confused with a pelvic exam.
Right.
Okay, but the Pap test is actually the collection of those cells of the cervix that we will actually send to the pathologist and let them take a closer look to let us know if they see anything abnormal.
Okay. And you did talk about the pelvic exam, so let's explain what the pelvic exam is and how it's different from the actual Pap smear.
So the pelvic exam is kind of what it sounds like. We actually do a manual examination of a woman's reproductive organs.
Okay.
So.
And you know, some women get a little nervous before they go in for these, and they can find reasons why they shouldn't go or why they can't go. So what do you tell women when they walk into your office and they're so nervous?
I said, I'm so glad to see you. And most of them, they tell my nurse that, oh, she's going to be so mad. I haven't been here in 5 years, or I haven't been to the GYN in 10 years. No, I'm not. I'm thrilled to death that you're here because it's so important.
Yeah. And it's just important to let women know that it's okay. You know,
absolutely. It's never too late.
Yeah. And just to relax, because the more relaxed you are, the easier it's going to be.
Definitely.
And the less uncomfortable.
Definitely.
So when should a woman actually begin having Pap tests and the pelvic exams?
So this is a little bit of a controversy,
Right.
I guess, especially maybe in the middle of the country. We're a little slower to catch on to the trends, but the American College of Obstetrics and Gynecology they have recently changed the recommendation. So it's now 21 years old for a woman to start receiving a Pap smear.
So it was 18 and now it's 21.
18, or you know, it was
3
thought
years
after first sexual activity, but actually age 21 regardless. So,
and maybe we could talk just briefly about, of course you and I know why they made some of those changes, but let's talk a little bit, because maybe the public doesn't really know the reasoning behind that.
And I get that question quite a bit, actually. the reason for that is we're going to talk a little bit more about HPV, or the human papillomavirus, which is very, very prevalent in a younger population. So actually, if you start screening women who are younger with Pap smears and HPV testing, you're going to get a lot more positives, possibly even false positives, which will lead to more aggressive treatment in a younger population, which can be devastating to their future reproductive health, future pregnancies.
Premature births, or not able to carry a baby full term.
Exactly.
Okay. And so we talked then about what they are and when they should begin, but how often should a woman come? And I know that it's different for each thing, but for Pap smears, how often should a woman be coming in to get those?
Well, I think classically it was, you know, you were told always come in every year for your Pap smear. Well, they've kind of changed the guidelines a little bit, and depending on who you talk to, whether it's the American Cancer Society, ACOG, you know, what I guess the majority of the data that's out there will say every 1 to 2 years, okay, for a young woman, meaning age 21 to 30. After 30, if you've had 3 negative Pap smears, you can actually move screening to every 3 years. Okay, so the best thing is to talk to your healthcare provider, talk to your OBGYN about what the recommendations are. I think the important thing for women is, at least my job, is to give women the information and let them make an educated decision.
Do you still encourage women, though, to come in every year to have their pelvic exam?
Yeah, very important distinction. We talked a little bit about the difference in the Pap smear and the pelvic exam. You don't ever stop having a yearly pelvic exam. You know, the importance of that pelvic exam for detecting other types of cancer, ovarian cancer, uterine cancer, still very important.
Okay.
Yeah.
So we just said we can't ever stop having a pelvic exam, which, you know, I'm always out there educating the public, and women always want to say, you know, what's the magic age where I don't have to, you know, I can stop? And I say, well, you know, there are circumstances for Pap smears, but there's not for pelvic exams. And I often explain to them now that we've seen a higher increase in some of those other female cancers because doctors have quit doing those pelvic exams, so no one's looking. You know, no one's feeling, no one's looking, and so we're having a higher incidence with the elderly. So it's definitely very important. But on the flip side of that, Pap smears, there are, you know, some things that you can talk to them about. So just kind of explain what the guidelines are for Pap smears on reasons why they could opt to stop.
To stop having a Pap smear. The information on this is also somewhat conflicting depending on who you talk to. ACOG will tell you 65 to 70. American Cancer Society says similar. AMA will actually say 70 years old. So the important thing to remember with this is what's the woman's history. If they've never had an abnormal Pap smear, or if they've had a hysterectomy for benign reasons, okay, fibroids or bleeding, not precancerous changes in the cervix, and they're not sexually active, then this might be a woman who's a candidate to stop having screening for cervical cancer. You know, but again, it's somewhat conflicting, and it's always important to figure out what her specific risk factors are for cervical cancer.
Definitely. I always tell women, you know, definitely talk to your doctor about that, because there are plenty of women too out there that have had hysterectomies, but they still have Pap smears because there's still things that can be screened.
Absolutely. If the hysterectomy was for precancerous changes in the cervix, these same changes can be present in the upper vagina. The upper vagina, the lower vagina, even the vulva. So very important.
Yeah, and so that's some things I think that some women, they don't have that conversation with doctors, and they just think, I had a hysterectomy, so I don't have to go back, you know, and it's done. So what does it mean if a woman actually, you talked about having Pap smears and, you know, they've had negatives or they've had positives. What does it mean if the Pap smear is abnormal?
When a Pap smear is abnormal, there's different levels of abnormal. It basically means that some sort of dysplasia or changes in the cell are present. The pathologist has picked this up when they look at it under the microscope. So they'll send us back a reading on the Pap smear, either normal or abnormal, meaning they did pick up some changes in the cell. And
typically, what's the next step with that? What would a woman receive? A phone call from your office or something?
Absolutely. Anytime we pick up an abnormal Pap smear, we let her know, first of all, your Pap smear was abnormal. We'd like you to come back for some further further testing.
Okay.
This is usually the colposcopy, which is the big fancy word for we just need to take a look at the cervix with a microscope,
right.
And see if there's any areas that may correspond to the abnormal, the dysplasia or the abnormal cells that we saw on the Pap smear. Okay. If there are some abnormal areas that we're picking up, we would want to biopsy those.
Okay. So that you could tell if it was cancer.
Exactly.
Okay. Well, what is the #1 cause of cervical cancer? You have all these abnormal Pap smears, and then if someone does receive a diagnosis, what's the #1 cause?
We talked a little bit earlier about HPV, but it's the human papillomavirus, and this is all somewhat more recent literature, I would say, within the last 10, 15 years.
Right. How is that? How does a woman contract HPV?
HPV, human papillomavirus, is sexually transmitted.
Okay.
So that's one thing that's important to remember.
Right. Yeah. Can someone get tested for the human papillomavirus? You know, can girls and boys both get tested, or?
Actually, the testing is only FDA approved for women. Which we do. We actually will test, especially I mentioned earlier, women over 30.
Right.
I do routine testing for HPV.
And that's in correlation with the Pap smear.
With the Pap smear, exactly.
So some women may not even know they're actually getting tested
Well,
for it.
it's important because if I get an abnormal result back, but the HPV is negative, I might not be so quick to act on that abnormal. I might feel more comfortable telling the patient, well, your Pap smear is abnormal, but the HPV was negative, so we can repeat this in a year.
Okay, that's good.
Yeah, absolutely.
That's very good. Let's talk about some of the risk factors for cervical cancer. Obviously, we talked about human papillomavirus being sexually transmitted, but what other things can contribute to cervical cancer as well?
Probably the most important risk factor for cervical cancer is frequency of intercourse or number of sexual partners. Something else that's also very important that goes along with this is age at first sexual activity.
Right.
If we've got a young girl who is sexually active and has multiple partners, and the people that she has chosen to be active with also have had multiple partners, it just increases her risk of exposure to types of HPV, because there's many different, over 100 different subtypes of the HPV virus. That could put her at an increased risk for cancer. Okay. Some other important risk factors would be smoking or immunosuppression, HIV, or a patient who has had an organ transplant is on, suppression for the immune system.
And that would also make it harder for them to fight off the HPV virus.
Absolutely. Any virus or sickness, it's going to make it harder for them to fight off. So the HPV just happens to be one of them.
Right. And then going back to some of those things we talked about earlier, those screening guidelines changing, we didn't talk about this earlier, but one thing with the HPV is they found that a lot of younger girls can actually fight off the HPV virus. It won't affect them, correct?
Correct, yeah. So the cervix in the body, for that matter, is actually very good at healing itself. So if we take the time to educate women and say, if you decrease the frequency of intercourse, if you use condoms as a barrier method, if you stop smoking, your cervix can actually heal itself and actually get rid of the HPV virus while there's no treatment. If you take care to protect yourself against the known risk factors, it's possible that your body could actually get rid of the virus for you.
Great.
Yeah.
So there is some good news behind it as well. So maybe somebody's out there wondering, how in the world would I ever know if I had cervical cancer? Maybe they haven't been to the doctor and had their Pap smears done. Are there any symptoms that they might be able to notice at home?
The #1 symptom for cervical cancer is bleeding after intercourse. Okay, so if you haven't been to the doctor, say in 5-10 years, and you notice that, maybe you see some spotting or bleeding, or maybe it's something that happens every time you're sexually active. This is a big clue. This is a big clue for women. Hey, maybe I need to get in and see my doctor. It's never too late. Let's get screened. In fact, I thought it was interesting when you were talking about the statistics earlier about the deaths from cervical cancer in this area in particular, it's interesting to note that a good portion of women who will die from cervical cancer have not had a Pap smear in the last 10 years.
Right. And I think some women, it may just get to the point where they're too embarrassed. You know, it's been so long. But just like you said, you know, you don't judge it. You know, they just walk in, you're glad that they're there, and you can help them.
Absolutely.
So women should never feel that way.
No, definitely not. It's so much better to get in, let's address the problem, and let's, you know, take care of it.
And be comfortable, you know, with the physician that you're with. And
absolutely.
That's one thing I always tell women, you know, if you're not comfortable where you're at or where you went before, find a new one, you know, because it's very important to be comfortable, especially for women. When you talk about, you know, what screenings we do need to go through.
Yeah. Who are you having sex with? How many partners have you had? These are sensitive subjects.
Yeah. So you need to be able to be comfortable with your physician to be able to talk to them. But then at the same point too, we probably need to tell women that there could be no symptoms, correct? Especially if it's an early stage.
Absolutely. Yeah.
So just because they're okay and not really feeling anything doesn't mean you're safe.
Nope.
One thing we can say though about cervical cancer, it is slow growing.
Absolutely.
One of the slower growing cancers, but you definitely want to get in at the early stage.
Yeah, that's part of the good news of the Pap smear is getting in with your annual screening every year. We're able to pick up those changes so much sooner that it turns cervical cancer into a preventable disease, which is so exciting.
Because there's very far and few between cancers that are preventable. There's only a handful.
Right. Absolutely.
So whatever we can do, definitely. So let's talk then about what we can do to prevent. We talked about, you know, actually seeing your doctor regularly. If you haven't schedule an appointment, call and make the appointment. What else could people do?
So we kind of talked a little bit about the risk factors. A lot of these are modifiable. So decreasing the number of partners, the frequency of intercourse with multiple partners, using condoms. I mean, that's a huge a huge thing that you can do just to protect yourself. Right. Use a barrier method and stop smoking.
Yes, that's a big one.
Yeah.
Yeah.
So I think those are kind of the number one things in addition to, you know, seeing your physician.
Okay. And then the other thing we want to talk about too is this HPV vaccine. Obviously it's one that can help prevent cervical cancer, but a lot of people out there have a lot of questions about the HPV vaccine. So let's just talk a little bit about it.
The big media scare, you know, that there's a bunch of side effects, I guess, when celebrities, you know, start saying that vaccines are responsible for my kid's autism, you know, it makes people scared.
Right.
You know, and I think a big part of what I do every day is reassure people it's a vaccine, just like the measles, the mumps, rubella. I mean, these are vaccines that have saved thousands and millions of lives. And this vaccine is still in its early stages of seeing the effects, the long-term effects that are going to be exponential for this country, I think, in the long run. But key things to remember, it's a vaccine. It's FDA approved for girls 9 to 26. So moms out there, it's important. If you've got girls in that age group, you know, you need to think about having them vaccinated, just like you would for, you know, rubella.
Right. And we should mention too that there's 2 vaccines for girls, so to talk to your doctor to find out which one you feel is best for your child.
Absolutely. There's what we call a bivalent vaccine and a quadrivalent. The difference is the quadrivalent actually includes the HPV subtypes for genital warts, so the low risk type 6 and 11, in addition to the most common high risk types, which are 16 and 18.
Yeah, it was interesting. I went to a conference a couple years ago, and it was right after the second one came out, and I was educated too on like how they were made, and they're both made differently. But it's so neat to hear that. But I did see data, you know, that they had, and so I often share this with women when they have questions. You know, they've got years. It hasn't been on the market that long, but they've got those clinical trials so that the data is actually farther back than what we actually have for the application. And so those girls that are still being in the trials, they're still 100% protected.
Absolutely.
By this vaccine.
The most common side effect is anytime you get an injection, it's going to be a reaction locally at the site of injection. Right.
And I think too, or maybe I should ask what you think about, you know, pain tolerance. That plays a great deal into it as well, with a girl's pain tolerance, because you know, and some people at the side of a needle.
Right.
You know?
Oh, yeah. Yeah. They're scared.
Yeah.
They're scared. But, you know, it's quick. 1, 2, 3. It's over. You're protected. It's a no-brainer, in my opinion.
Yeah.
Yeah, absolutely.
Well, let's talk a little bit about the HPV vaccine. And we discussed what it is and what it protects against. But some people may think that they can just go into the doctor and get one shot and it's over with. So let's talk a little bit about that.
Yeah. So it's a series. It's a vaccine series, actually 3. The first one is what we call time 0. The second is going to be a month after that, and the third is going to be about 4 months after that. So it's actually 3 vaccines.
Okay.
Important if you have at some point gotten lost on track and you didn't you missed the second one or you missed the third one. It doesn't matter. You can just pick up where you left off and just, you know, go ahead and finish your series.
And so do parents come into your office and ask you, you know, we know it's 9 to 26, but do they say, what age should I really give this to my child?
Absolutely. I think a lot of women, moms out there are actually scared to think that their daughter might be at some point sexually active, and so that kind of prevents them from thinking about protecting them in the future because they're scared to think that they might become sexually active.
Right. And a lot of the publicity behind it too was, you know, they felt, a lot of people put this out there in the media, that it promotes premarital sex. And one thing I'd talk about, I don't know what you say to mothers in the doctor's office or not, but I tell them, you know, this is something that you can make a decision for to protect your daughter in the future, because of all the control we have of our kids, which is sometimes far and few between as they get older, one thing we definitely do not have control over is who they pick as their spouse.
Absolutely.
And we have no control over what that spouse decided to do before they ever met our child.
Absolutely.
And so, you know, sometimes when you put it like that to a mother, it kind of makes more sense to them.
I'm getting more and more reception from women, moms in particular, about having their daughters vaccinated, which is, it's exciting. It's exciting to me to hear that.
Yeah.
You know, and a lot of them, I would say just in the past couple of weeks alone, I think almost every patient, you know, young lady that I've asked, oh, I've already got my vaccines.
That's
I'm
great.
done. Yeah, it's exciting to hear. Yeah.
Right.
So,
well, what about boys? You know, people often think, well, I've got a boy, so I don't have to worry about it. But is there a vaccine available for them?
Yes. So the vaccine is also FDA approved for boys. So get them vaccinated. In my opinion, you know, just like you do the girls. It's going to be a huge part of prevention in the future.
And that just really recently started taking off. The FDA just approved it a little bit, probably over a year ago for boys, and only one, Gardasil, is the one that's approved for them. But you know, it was amazing to watch it, how far and few between offices were offering it, and now it's pretty widespread for boys.
Yeah, it used to be kind of, well, what do you think? I think it's a great idea. I mean, and I used to tell, it's not exactly FDA approved yet, but it makes sense.
Yeah.
I mean, the girls are getting it from somewhere.
Right. Right. And, you know, before too, I've heard of other doctors say it's not just HPV that's found in cervical cancer, it's other strands of cancer as well that they're finding it in, even in head and neck cancers.
Oh, yeah.
So, you know, kids are out there doing different things, and so it just needs to be protected for overall, because you never know where HPV is going to be found. I also want to talk real briefly about sometimes you may have patients that come in and they don't have insurance, or you know, maybe they're underinsured, maybe their insurance doesn't cover all those screenings, and so there is a place available in Paducah where they can be referred to, and they can go to the health department. And I don't know how many people you see like that, but we definitely want people to know out there that they can go to the health department, and we do have some information on the screen for that. If there's anybody out there that is underinsured or uninsured, please call the health department, and the number's on the TV right now, 444-9631. And what they can do is they'll actually screen you at the health department for breast or cervical cancer, and then if you're found precancerous or a cancerous condition, then they'll refer you out to a local OBGYN for treatment. So there's options out there. You know, that's one thing I think people say the most is, well, I just don't have the money. But, you know, there are. And even, I know people may not know where your office is, but it's at Lourdes.
Yep.
And there's programs there at Lourdes that can help people as well.
Yep. We have programs for people that can't pay, people that maybe are having a hard time. You know, that's one thing that I've really enjoyed about working for CHP is really the mission and what they stand for. And I promise you, if it walked through the door, I'll take care of it. So, you know, regardless of what the problem is, how big or small. And that's just, you know, I feel as important as part of, you know, working for such an organization, but just part of who I am as a physician.
Right.
You know, it's what I love to do. So.
And that's what women need to hear, you know, because I think one thing too with women we're guilty of is that we worry about everybody else in our family and we worry about ourselves last.
Oh, I can't tell you how many times a day I hear that.
And they just put it off. And so you've got women coming into your office, like you said earlier, 5, 10 years out, or maybe even more. And some women that maybe have never had one. And so for them just to take that effort to go into the office, you know, and you're open and so welcoming to them will make a huge difference for them.
I hope so.
So that's great. Well, let's just talk then about, after everything we've talked about today, which has been a lot, we covered a lot in a short little time. What's the one message you want people to be able to take home from today?
Cervical cancer is a preventable disease with modifiable risk factors. And I think the education of women about these facts, it's huge. Just knowing that, just knowing why we do a Pap Smear, you know, every year, every couple of years, just knowing why will make so many women, I think, just be, you know, more aware and more aggressive about taking care of themselves.
That's great. Yep. Well, I would like to give everybody your contact information too. Dr. Wagner, of course, is new to Paducah. She's been here though for about a year, right?
Yeah, a little over a year.
Yeah, but she still is accepting new patients. So if you would like to come visit Dr. Wagner at her office, her number is 538-5700, and you can call the office and ask to set up an appointment with Dr. Wagner, and she'd love to be able to take care of you and help you with your screenings or your questions on the HPV vaccine. Today we've talked a lot about cervical cancer and what you can do to prevent cervical cancer in the future. And so if you have any questions about today's show or want more information, please feel free to contact our office, the Kentucky Cancer Program, at 270-442-1310. Thanks for joining us today, and we'll see you next time.